setting up your meeting for Facebook Live. It says it's done and it's redirecting us to Facebook Live. So there we are. We are there. Okay. Hello. The meeting is now live streaming. My name is Mandy, and I'm with COVID Recovery Iowa, which is a peer-to-peer counseling support network where it's free, and you can call us on our hotline for assistance and website submissions. And today we're doing a Facebook Live in our Parenting in a Pandemic group, and I have with me Nina from Nami, and she's going to be talking with us today about mental health. And we're excited to have her here. How about Nina, just tell us a little bit about Nami to get started, if that sounds okay?
Sure. So Nami is the nation's largest and oldest grassroots mental health organization. And we offer a variety of different programs, as well as supports and advocacy opportunities for people living with or supporting a loved one with a mental illness. And what makes all of our programs unique is that they are all led by people with lived experience. So that's what makes us a little bit different than a counseling service, is that we are volunteer run and we have people that understand.
And it's a, did you say nationwide program? Is that correct?
It is nationwide. So we have a national organization which creates the curriculums for our programs. And then we have state organizations, like the one I work for is Nami, Iowa. And so we are serving the local affiliates, which are 15 organizations around Iowa that are providing majority of the programs. So the things like the classes and the support groups and the local connections. So there are 15 around Iowa, and they are in 45 of the 99 counties. So for the other counties where there isn't a local group, then NAMI Iowa is helping to get programming to those counties. And so one of the programs that we're going to talk about a little bit later, called Ending the Silence, is one of those programs that we can take to any county to get people more information about mental health.
And bringing things to people virtually like this, wow, we've all had to learn new ways to try to connect with people during the pandemic so that we can keep each other as safe and healthy as possible. Which makes me think of the program you were mentioning, the Ending the Silence. We are going to offer that in December, on December 8th. And even that, just so all our viewers know, we had to discuss on a national level offering such programs live and what that would look like. And so it was determined that you'll present that live on the 8th, and it immediately has to be deleted after. And so I'm putting that out there because I want as many people to be able to watch that as possible. But yes, we'll talk more about Ending the Silence a little bit later. But so what kind of trends are you seeing with mental health and the pandemic?
Yeah, so we're hearing about a lot of increased depression and anxiety. And also, I think people are they're feeling fatigue from COVID, right? We've been doing this now for 8 months. And so there's some things that are emerging that are, sort of artifacts of that. I think there's, an increase in stress overall. There's an increase in drinking, maybe alcoholism. There are some reports about child abuse numbers are down, but they say that is likely because those that are the mandatory reporters are not having as much interaction with kids. So, people are just feeling the pressures of spending a lot of time with their family members. And I think there's just a lot of struggles all around for people. There's also those that aren't living with family members or just aren't having as much interaction with friends, and other family are feeling depression because they're feeling isolated. So it's a really hard time for people. And I think parents especially are feeling it because they're trying to help their kids, and kids are suffering too. Plus there's the virtual schooling situation, plus parents trying to work either in the home, or if they're essential workers, they're out, they're trying to do their work and care for their kids. And so I think there's just a lot of pressures. The data says that in any given year, 1 in 5 people will have a diagnosed mental illness. And what we're seeing now in terms of data trends is that it may be closer to 1 in 4 during the pandemic, that people are feeling a lot of, increased stressors, and that's leading to more anxiety and depression diagnoses.
So let's take anxiety, for example. Okay, so maybe today, I'm feeling stressed. Maybe technology is not cooperating. It actually was cooperating for me today, but there are definitely days where it doesn't. So how do I know when my stress is reaching the level where maybe I should reach out for help? And what does that reaching out for help maybe look like?
Yeah. Well, the thing I like to share with people is that remember that mental health is a spectrum, right? So on one side we have wellness, and on one side we have illness. And everybody falls somewhere in between. And what we have the ability as individuals to do is to work more towards wellness. And there are a variety of things that people can do to work towards wellness. But there's also illness. And so there is a point where you want to get medical professionals involved to offer some more supports. So some of the things that I encourage people to do on their own is really to figure out who your support network is. And I think about it right now a lot in terms of your employer, because I know a lot of people are feeling stress around work. So does your employer have an employee assistance program, an EAP? Could you reach out to them and find out what resources are available? Could you find out, does your insurance plan offer any free counseling, so that you could just kind of get a feel for it and talk to someone? There's also hotlines, and you mentioned that. So I think that's another great free resource that people can, they can just try it. They can reach out and see. But even less formally than that, I think just thinking about who is your support network, who are your people, and could you reach out to them? And right now it's a tricky time with the in-person options, but could you reach out to someone virtually or over the phone, and kind of who are your people that you can fall back on if you don't feel like accessing some of those more formal supports? And I think just, all of us knowing that this is a hard time, and just giving ourselves some grace to just feel it and know that we may not be at our absolute best, but if we can just make it through the day, then tomorrow's a new day. And so a thing that I've been doing, I'm not a mental health professional by training, so this is just something that works for me. But what I've been trying to do is make some kind of plan for the day. So just think of something that brings me relaxation or comfort or peace of mind, and try to incorporate that into my day. So for me, something that really helps me is movement. I always feel like I'm in a better place if I just get outside, or I just, get up from my desk and move around. And so I'm trying to be really conscious about movement right now, especially with winter coming, and just making myself do it, even if I in the moment don't feel like doing it. It's a thing that I've identified for myself, where I know, no, movement does actually help you. And so I would encourage everybody to think about, what makes you feel good? Does music make you feel good? Does like a certain thing that you can look forward to eating, that you can make feel like something that would be a good part of your day? Just talking to a friend help? Just what are some of the things that bring you comfort, bring you joy, and how can you incorporate that in a small way into what you do every day?
And sometimes you just have to assign it to yourself, I think. I'm going to do this. This is part of my day. And
Yep. Make time for it and commit to it in your brain. Because sometimes with the movement, I'm like, oh, I don't want to go outside. It's cold, or it's dark now early. And that to me just feels like, oh, I'm just going to sit on my couch. But I do know that if I get up and go outside and go for a walk or do something, I do feel better. And so you're right, just making that commitment to it and saying like, this is going to be part of my day.
Yeah, whatever it is for you. Yeah,
Mhm.
you made me think of so many things. It makes this 15 minutes go by so fast. But I'm thinking about our parent support group that is tonight from 5 to 6, and I'll put the Zoom link in the comment box at the end of this. I'm also thinking about just you mentioned COVID Recovery Iowa is one of the resources, and I should just say the hotline number that I have memorized is 1-800-447-1985, and that's that peer-to-peer support. And then if through those conversations you decide you need more mental health assistance from that licensed provider that you were talking about, we can get you connected with that as well. But reach out to someone. I also was thinking about Zoom meetings with families, and not everyone has access to that. But for those that do, if you have a smartphone, if you have a computer and you have Wi-Fi, it takes some effort. There's a learning curve to it, but it's worth it. I'd say give it a try. Plenty of people are like, oh, I don't know how to make that work, or I don't know how to do that, but you can make it work. And it's just one safe way right now that we can connect with people, and it can be a challenge at first. But you really can connect with people in this way. I have found. I will advocate that in person will always be best, but this is what we've got right now. So
Yeah, see if your kids or your younger family member can help you learn how to do it.
right.
My kids are a lot smarter than I am about technology. I'm not too bad, but they are better. So yeah, see if someone can teach you.
Absolutely, yes. Recruit the younger generation for sure.
Yeah.
Okay, so I'm looking. Let's talk about what this ending the silence will be like. Again,
Yeah.
we're talking December 8th, 2
Mhm.
p.m. Again, Facebook Live, but you only have the opportunity to view it at 2 p.m. from 2 till just about 3 o'clock.
Yep.
So why should people tune into that and tell us what it's going to be all about?
Yeah, sure. So it's a 50-minute presentation and it's on the signs and symptoms of mental illness. It also talks a little bit about suicide prevention, and it will get you in touch with some resources that are out there. It is a program it's a nice introduction. So it doesn't go too in depth, but it really gives you some you get to connect with people with lived experience because there's two presenters. So it really gives you some perspective from those that either are living with a mental illness or have a family member living with a mental illness. And that's what we hear from people. It's the power in the program is just the sharing of those stories. So we'll give you information, but we'll also share our stories. And I'll be one of the presenters, and someone else will be with me. And she's a young person living with a mental illness, and she'll share her story as well.
That is so fantastic. It's going to be good. I'm excited. Thank you for researching how to go about that in a virtual world, because I know that took effort. And thank you.
Yeah, we've been working on that. We spent the late summer adapting our programs to be virtual because we realized people need it just as much now as ever. So we wanted to get it out there to people. And our national organization has the requirement about no recording. So what I want to say to people is if you do miss the program, if you can't make it at that specific time, we would love to do this program anywhere for any group, and it's free. So if you have a community group that you're associated with, or even if we wanted to do another session of it with you guys for the parenting group, we're open to that. And we just like to get the word out about it. And we have a lot of presenters trained that are happy to do it. So we could always do it again sometime.
Sounds good. We know the need is there.
Mm.
So let us provide those services to you. So tune in on December 8th, 2 o'clock. And Nina and another coworker of hers are going to present to you about lived experience and mental health. It's going to be good. Thank you, Nina, for your time this morning. It was nice
You're
talking to you.
welcome. Good to be here.
Happy Thanksgiving, everyone. I know it's looking different, but we can make the most of it. Lots to be thankful for.